There's a bottleneck. We've increased the number of medical students at medical schools across the country, but the number of training slots hasn't increased.
That word of warning comes from where I grew up. That was someone at Wake Forest Baptist Medical Center in North Carolina in Winston-Salem talking to a reporter from Fox 8 in High Point about a very startling new study.
Now, according to a new study from the Association of American Medical Colleges, the U.S. may face a nationwide shortage of 90,000 doctors by 2025.
The AAMC says the demand for doctors has increased due to us living longer and needing more medical care as we continue to live longer. So, is it time to panic, or is there the potential to fix those shortages now? For more on Health Matters, let's call on Nick Tate, our Newsmax deputy health editor and the co-author of Da Vinci's Baby Boomer Survival Guide. We see the survival guide, so Nick, how do we survive this shortage of MDs?
Well, you know, JD, many places in the country are already facing doctor shortages. About 1 in 5 Americans now live in a region of the country where they can't find a primary physician. There aren't enough to take care of the needs, and that's going to grow as the number of boomers turn 65. 10,000 Americans a day are turning 65, and of course, over age 65, we know that we use twice as much healthcare services and have twice as many healthcare needs as people under 65. So it's really going to be important that individuals are picking their doctors. Their health plans need to make sure that their health insurance plans, which are becoming narrower and more difficult for many Americans, they need to be sure that their doctors are on those policy plans, and making sure that you have a good relationship with a doctor that continues. So this is another warning that as we get older and more services are going to be needed, the number of doctors is actually shrinking.
Nick, let's switch gears now to another health issue of PSA screenings for prostate cancer. The latest study suggests men just aren't getting PSA screenings as a result of new federal guidelines.
That's right. In 2012, federal health officials recommended that the PSA not be given to men as a routine cancer screening, and that's in part because the test is imperfect. It can indicate an elevated risk for cancer, but it can also simply indicate something like an infection or an enlarged prostate, and in the wake of those tests, many men get very aggressive treatments. Surgery, cancer, radiation. If you have cancer, sometimes the cure can be more difficult for you than the disease itself. It can lead to impotence, it can lead to incontinence, and in many cases, men with prostate cancer, it's a very slow-growing cancer, they would never die from it. So those guidelines were made in 2012 to try to reflect that reality. The problem is that this new study finds that there's a large number of men, as many as 14,000 a year, who would have been caught and diagnosed with high-risk cancers that kill about 1,400 men, but they're not getting the testing because the federal guidelines recommend that men not get the test. So this is one of those cases where a kind of one-size-fits-all health guideline really does not apply to everyone. And if you are a man who is at risk for prostate cancer because your father had it or a brother had it or an uncle, you really need to be looking at that PSA test as a possible lifesaver and talking to your doctor about the benefits versus the risks, and not just follow that one-size-fits-all federal guideline.
Well, about those federal guidelines, 45 seconds, Nick, I got to tell you, I'm very skeptical. All this seemed to come along with the advent of Obamacare. Was this sound science, or was this political science about changing the PSA screening?
You know, hard to say, JD. I do think that the politics do affect some of the health guidelines that are recommended. In this case, it did seem to be driven by a desire to reflect that there are uncertainties about the PSA and that it is imperfect. But the upshot is, for individual consumers, is you have to really make sure that you are doing what's right for you and not just simply following what the federal government tells you is in your best interest. Sometimes that's not exactly the case.
Fair enough, and we always understand that we got to look out for ourselves, and those of us who are a certain age can do well by checking out a newly released book, courtesy of our friend Nick Tate, Da Vinci's Baby Boomer Survival Guide. You can get your copy by going to babyboomers711.com. There is more with Nick Tate for you to contemplate, so don't hesitate and don't be late. I'll stop the doggerel here and just say America's Forum continues right after this timeout. Stay with us.
There's some secret ingredient in these Nutri-Yum bars that make me feel so good.
Sugar. It's a block of sugar.
Well, a humorous take from the cast of Parks and Rec on NBC about sugar, but the new World Health Organization guidelines on sugar don't have a lot of beverage companies laughing.
No, the Department of Nutrition for Health and Development is recommending that adults and children reduce their daily sugar intake to less than 10%. The whole crew is listening right now. 10%, guys, and another 5% for added health benefits. Everyone here is crying right now.
No, Miss Mary instituted that at the Hayworth Hacienda
Smart
a few
woman.
months back, so we're moving forward with that. Meantime, the beverage companies, as we mentioned, are up in arms. So let's continue our conversation with Nick Tate, the Newsmax deputy health editor and co-author of Da Vinci's Baby Boomer Survival Guide. So, Nick, the beverage companies got to figure out a way to reduce sugar, or are they just going to stick with what they got right now?
Well, that's right. I mean, one of the big sources for sugar is sodas and fruit juices, and you know what these guidelines basically recommend that people take down their sugar intake from products that have added sugar to about half to a third of what we're getting. Now, the target and the primary focus of these guidelines is those added sugars in processed foods and processed drinks. So obviously the soda drinkers are not happy. The background here is that for a long time we've been hearing about fat in foods. Fat, it turns out the research shows, is not as big a concern. It's really the sugar and it's really the carbs that people need to be cutting down to reduce their risk for obesity, diabetes, and heart disease.
So how much sugar is too much sugar? Like, how much do Americans consume?
Most Americans consume about 10 to 15% of their diet is sugar. That's about 2 to 3 times as much as the World Health Organization recommends. And I should also point out that there was a guideline that came out last week from federal health officials in the U.S. that also recommend that people take down their sugar content to 5 to 10% of their diet. So it's cutting back on things like soda, it's cutting back on fruit juices, it's cutting back on those products that many of which are billed as low-fat or no-fat foods. One of the ways that food manufacturers get the fat out of those foods is they add sugar and they add carbs, and of course now we know that those are really the problem, not the fat.
Well, let's talk about another situation where something's being cut out. McDonald's announcing that they'll stop selling chicken raised on human antibiotics. Why this shift right now, Nick? Well,
McDonald's and actually Costco has also said that they're going to stop selling products that have antibiotics in them, and the concern is that antibiotic-resistant bacteria are on the rise in humans. We're seeing these superbugs that are emerging in part because of the overuse of antibiotics, and not just in human patients, but many farms and many places that produce not only chickens but also pork and beef also use antibiotics to keep those animals healthy just as a routine basis. And experts believe, both science experts and public health experts, that that is partly contributing to the rise in these antibiotic-resistant superbugs.
So, McDonald's takes this health stand. You take a look at the beverage companies, and we've seen different ads, Nick, a consortium of soft drink manufacturers talking about responsible nutrition. McDonald's may have changed something about the chicken they're using, but are the beverage companies really going to change anything about their sugar content, or are they just going to say, hey, buy some of the bottled water we have instead of our signature soft drinks?
Well, that's already starting to happen. We're seeing that many beverages are being marketed, and foods, as healthier for you than in the past. I think the bottom line is it's really incumbent on consumers to figure out what makes most sense for them. Read the product labels. Don't necessarily follow what the marketing message is, but make sure that you're eating and drinking those foods that we know are healthy for you. There are whole foods, lots of fruits and vegetables. The naturally occurring sugars that are in fruits and vegetables are not a problem. It's the added sugars in those processed foods. So you got to be a savvy consumer here to really boost your own health.
And one thing that will help you become a savvy consumer is to pick up Nick's new book, Da Vinci's Baby Boomer Survival Guide. You can get your copy by going to babyboomers711.com. Now, of course, Miranda, generations separate us, but my fellow baby boomer, Ed Berliner, is away today, a little under the weather. So young John Bachman is standing by with Midpoint. We will look for you tomorrow, 9 in the east, 6 in the west. Stay brave, stay free, stay tuned.